الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. ما زلنا في infection control measures. Now we are going to discuss cleaning and waste disposal procedures by Professor Mahmoud Hani Sulaiman. Cleaning. General, cleaning is important particularly in work areas due to deposits of dust, soil, microbes on surface can transmit infection. Contaminated area as operating rooms or isolation rooms must be cleaned after each session. A spot cleaned after each case or thoroughly cleaned as necessary. The following basic principles should be followed. Written, again, I am emphasizing written. Written cleaning protocols prepared, including methods and frequency of cleaning. They include policies for supply of all cleaning and disinfectants. Standard precautions implemented on cleaning surfaces, facilities. Cleaning methods should avoid generation of aerosols. All cleaning items changed after each use and cleaned and dried before being used again. They also changed immediately after cleaning of blood or body fluid or substances, cleaned and dried. Single-use cleaning items preferred if possible as cleaning clothes, which should be lint-free. Sprays should not used as they can become soiled and are difficult to clean. Sprays are not effective as they do not touch all parts of the surface clean. Detergents should not be mixed with other chemicals. All cleaning solutions should be prepared fresh before use. Specific surface cleaning. Floors in hospitals and daycare facilities cleaned daily or as necessary with vacuum cleaner fitted with particulate retaining filter which changed in accordance with manufacturer's instructions. Exhaust air directed away from floor to avoid dust dispersal. A ducted vacuum cleaning system can also be used as long as safe venting of exhaust air is ensured. Damp dusting is essential. Using a lint-free cloth, brooms disperse dust and bacteria into the air and should not be used in patient clinical areas. Dust retaining mops, which are specially treated or manufactured to attract and retain dust particles, do not increase airborne counts as much as ordinary brooms and remove more dust from surfaces. So, dust retaining mops are good. However, brooms and dust retaining mops should not be used in clinical areas where there is a high risk of infection associated with dust, e.g. burn units. Procedures for routine surface cleaning. All cleaning solutions should be prepared immediately prior to use. Work surfaces should be cleaned with neutral detergent and warm water solution, rinsed and dried before and after each session when visibly soiled. Spills should be cleaned up as soon as practical. When disinfectant is required for surface cleaning, manufacturers' recommendations for use and occupational health and safety instructions should be followed. Buckets emptied after use, washed with detergent and warm water, rinsed in hot water with stored dry turned upside down. Mops laundered or cleaned in detergent with warm water, rinsed in hot water, then stored dry. Mop heads should be detachable or stored with mop head uppermost. Specialized areas. Isolation rooms with ensuite bathrooms cleaned at least twice daily, dependent on type of organism. Operating rooms with day procedure rooms, operating rooms with day procedure rooms, including endoscopy rooms, cleaned after each operating session and when visibly soiled. Thorough cleaning of operating suite performed daily, in addition to cleaning performed after each operating session. Obstetric areas, particularly delivery suites, cleaned after each delivery and when visibly soiled and at least daily. Oncology areas cleaned twice daily. Sterilized processing departments cleaned at least twice daily and when visibly soiled. Wet areas, toilet, sinks, wash basins, baths, shower cubicles, all fittings attached to showers, baths and hand basins, surrounding floor and wall areas cleaned at least daily, more frequently as required. Walls and fittings, walls and screens cleaned quarterly or if visibly soiled. Blinds and curtains cleaned quarterly or if visibly soiled. Carpets vacuumed daily and other floor surfaces washed daily and when soiled. Bed and examination screens changed weekly and when visibly soiled. Cleaning of Creutzfeldt-Jakob disease infectious agents. Spills of CNS tissue or cerebrospinal fluid should be absorbed into paper towels and disposed by incineration. The surface should then be soaked with 1 molar sodium hydroxide or 2 to 2.5% sodium hypochlorite, left for 1 hour, and cleaned again with paper towels that are disposed by incineration. Spills of blood or other body fluids and tissue should be cleaned using standard spills management procedures. PPE used when cleaning contaminated surfaces should be incinerated after use. Reusable eye protection should be cleaned as above. Maintenance of cleaning equipment. Cleaning items should be changed after each use. They should also be changed immediately following cleaning of blood or body substance spill. These items should be washed in detergent and warm water, rinsed and stored dry between uses. Mops with detachable heads should be laundered between uses. Spills of lab cultures of human pathogens. Spills of lab cultures should be absorbed onto paper towels and disposed of as clinical waste. Contaminated surface should be treated with 2 to 2.5 sodium hypochlorite, left for 1 hour, cleaned again with paper towels that are disposed of as clinical waste. Waste disposal. General, all healthcare facilities should have written policies, procedures in place for correct management of all waste generated. MOH also has guidelines on management of waste generated in healthcare facilities. Waste is classified into 3 main groups of waste: general, clinical, pharmaceutical. All waste should be stored in secure areas until collected. Waste disposal companies licensed with Environment Ministry will collect all clinical, pharmaceutical waste or for disposal in specialized waste disposal facilities, which are also licensed. Waste should be removed from all clinical areas at least 3 times per day and more frequently as needed, as from specialized areas. Waste bags should be tied before removing from area. General waste placed in general waste bin for removal. Clinical waste placed in biohazard bags as soon as possible. Biohazard bags have a biohazard symbol and are currently colored yellow. Single-use sharps should be placed into a sharp container that meets country standards. About pharmaceutical waste, when uncertain about how to dispose a leftover of pharmaceuticals, they should be returned to pharmacy for correct disposal. Most disinfectants can be disposed of through sewer system by running cold water into sink prior to pouring disinfectant into sink. Leaving cold water running for a few moments after disinfectant disposed of as this dilutes the disinfectant. وفي النهاية لا أجد إلا أن أقول لكم thank you والحمد لله رب العالمين.